BC Conservative Party unveiled its healthcare election platform today, an overhaul of the system that it says will reduce wait times by increasingly sending patients to private clinics and out of province for care. For more, let's bring in Rob Shaw at the BC Legislature. Now, Rob, this is a significant proposal, a major proposal. Walk us through it.
Well, Stacey, it's the most detailed policy we've seen from the Conservatives on the most expensive service that government provides. And really one of the most contentious topics today are flagging public health care system and whether it couldn't be improved by including private for-profit services. Rustad unveiling his platform in Vancouver today, saying BC spending more than ever, $36 billion this year, a 72% increase from when the NDP took power, but getting worse outcomes than many other comparable countries. Here's the pillars of his plan: a guaranteed medically set wait time for tests and surgeries, or else a province will pay to send you to another province or country. It's built off Ontario's model. The NDP already doing a bit of this right now with cancer care in Washington state. Expanding publicly paid procedures at privately run clinics, what will get long-term government contracts. Changing hospital funding from a block model to a per-patient model to try and move more people through the system more quickly, reducing ER wait times. And then on staff, the Conservatives proposing to eliminate that vaccine requirement for healthcare workers, repeal Bill 36, the changes to the health colleges, and add more training spaces, contracts, and incentives.
That new model will be universal healthcare, single payer, but it'll be delivered by both government and non-government agencies. And I'll just give you the example, using your health card. That's all you will need for services. That's the only piece of plastic you'll need to take out to get the services, regardless of where you get those from.
Reaction pretty mixed. Worry from healthcare unions about privatization. The BC NDP saying this amounts to really a kind of a cut to health spending. It isn't quite outlined in the Conservative plan. And United saying most of these ideas it actually proposed weeks ago.
At a time when we should be investing more in healthcare in British Columbia, John Rustad and the Conservatives are proposing taking money away from our healthcare system.
What the John Rustad party has done is just effectively copied what we came out with. I think this will be a pattern that you're going to see, because we take policy very, very seriously at BC United, because we have a track record in government.
Talked to Health Minister Adrian Dix today. He said a lot of this could come down to finding efficiencies in the system under Conservative plan that would ultimately reduce rural and remote health care, which is the least efficient. Stacey, not quite what the Conservatives have proposed. There is no costing in this plan today, which makes it a bit difficult to gauge how a new Conservative government could afford this and what the impact would be on BC's finances. But we expect to push the Conservatives for some more numbers there in the weeks ahead.